Macedonia is a small country, 2 million people. The statistics, 14% of the population are age 65 and more. Also, the average age length of life expectancy is 76 years, and it's growing each year. So from other side, we have a very low number of patients with diagnosed dementia. There was no previous studies on the prevalence of dementia in Macedonia. Most of the patients were diagnosed later in hospitals. That's why that was an idea in collaboration with psychiatrists to perform such a study to see what is the prevalence. And from other side, it was the idea to increase the awareness of GPs for early identification of patients with dementia. Also, to see what is the care of patients with dementia in Republic of Macedonia and what are the barriers in this field. So it was a multi-center prospective retrospective study conducted by the medical faculty in Skopje, Center for Family Medicine in 2017. We involved 46 GPs from selected randomly from all parts of Macedonia. And their involvement was voluntary. We prepare a questionnaire, and each doctor searched the database of patients reported to him, and for each patient with diagnosis with dementia, fulfilled the questionnaire. So actually, those 46 GPs cover 75,000 patients in their register, and patients over 65 years old were almost 13,000. When we saw the prevalence of the diagnosed patients, the overall prevalence was 3.5%, and we saw that as the age is increasing, also the percentage of the prevalence of dementia is increasing. Most of the patients were female, and also the predominant is Alzheimer's disease. Also, those results show that most of our patients were with basic elementary school, and the family history of dementia was confirmed in 11.6% of patients. Speaking about the risk habits, we saw that still 16% of patients are smoking cigarettes and 7% of patients are consuming alcohol. While the physical activity, we see that only 20% of them are physically active. Most of them are sedentary regime. When we saw what are the risk factors, we saw that 1/4 of the patients actually have multimorbidity. Of course, the hypertension was most present diagnosis in those patients, but also 1/4 of the patients had diabetes, elevated cholesterol, and stroke. Obesity was mostly present in the female, dominant in the female patients. So, what is the care? How they live? Actually, this study shows that most of the patients are living with their spouse or living with the family members. A very small number of those patients are living alone, while or are settled in the homes for elderly people, in nursing homes. So speaking about the treatment, we saw that we have to say that half of the patients take some medications, OTC therapy. It is not evidence-based, but usually it's the family members that are buying those therapy for them, expecting that something will be improved. Speaking about the treatment, also half of the patients actually are not receiving medication. Why? Because when we saw memantine is not covered by the health insurance fund, usually the patients are buying by themselves from pocket. It is expensive and that's why they are not using. And also we saw that one of the reasons why also they are not taking the medications were that lack of medical services in small cities. There are not enough psychiatrists who are taking care for where the GP can send the patient to make a diagnosis and prescription. But also there is stigma from the family members. They don't accept the diagnosis and the treatment. Also, 4.4% of patients said that they are receiving a lot of other medications for diseases, for diabetes, for hypertension, so they don't like to take more medication. So basically the reasons, the barriers why those patients are not treated well from both sides. From health side, not enough psychiatrists, not the medication are not available from health insurance fund, too expensive, but from other sides also from the stigma and problems from the family members. So actually this study helped us as a GP to make a better communication with the Association of Psychiatrists in Macedonia. Based on those results, actually, we perform a pathway that will help to GPs to make early diagnosis and send patients and organize better treatment and care of those patients. In the last year, actually, we had a lot of workshops organized of both associations, educate GPs how to recognize, how to make a diagnosis and treat those patients. There was a World Psychiatrist Association symposium organized on dementia, and general practitioners were invited as active participants on this symposium. And also all those barriers we try to negotiate with health insurance fund to organize better care of those patients. So it will be interesting to see how all those interventions will improve the diagnosis, the better diagnosis of dementia, and better care and quality of care of life of those patients in future. So thank you.